Hi, everyone, and thank you for joining us at the Legal HR Summit. The Legal HR Summit is a two-day online event hosted by Ius Laboris, the largest employment law alliance in the world. The session is part of the Americas block and will be followed by other curated sessions of the region. I am now turning over to Marcela to begin the session. Go ahead, Marcela, you're welcome to start.
Hi, my name is Marcela Salazar. I'm a partner in Munita and Olavarria, and I'm specialized in employment and immigration law. Maria Ignacia.
Hello, everybody. My name is Maria Ignacia. I work at Cisco. I'm based in Chile, and I work in the People and Communities team.
Well, my name is Ignacio Maciel. I'm a head of HR here in DHL Chile, the BGF division.
Hi, my name is Hillary Grice. I'm an associate lawyer at Matthews, Dinsdale and Clark, which is a Canadian law firm, and I'm focused on labor, employment, and human rights law.
Hello, my name is Tony Harrington, and I work for Homewood Health. We provide mental health and addiction services across the country of Canada, and I specialize in psychiatric mental health.
Thank you, Tony. Now we are going to start with our legal summit. Are you taking care to take care the importance of health and wellness initiatives for your company culture? In Chile, the employer has a legal duty to take all the necessary measures to effectively protect employees' health, which includes their mental health. Therefore, employers must play a key role to support their employees and create an environment where they feel comfortable. Also, a workplace where they can raise their concerns and reach out when they need it. In this sense, there has been more awareness about mental health at work since the coronavirus outbreak began. Companies have understood that mental health issues will have a significant impact on their employees, as they are all facing unprecedented challenges and they are working in ways they have likely never had to before. In fact, home working can present risks, including feelings of isolation and inability to disconnect, which now employers must struggle with. Therefore, employers in Chile are seeking ways to take all the steps that are reasonably necessary to ensure the health, safety, and welfare of their employees, and provide and maintain a safe system of work, including for employees working from home or remotely, in order to comply with their legal obligation. But how in practice are employers in Chile taking care of the obligations regarding mental health at work? What mental health support have companies provided to employees during COVID-19, and how employers are dealing with those employees working remotely? For answering this and some other questions, we will speak later with Maria Ignacia Silva and Ignacio Maciel, both working in human resources, who will explain to us how their companies are dealing with the obligations on mental health at work. Would you please have the poll, Isadora? Now we do have a poll that we want you to answer. Take your time, and then we'll have the results at the end. Isadora, would you please start with my slides, please? Thank you very much. Well, in view of the high number of employees suffering mental health problems in Chile, in 2016, the opposition parties in parliament introduced a bill to recognize and guarantee the fundamental rights of people with mental illness or disability, specifically their right to personal liberty and the right to health care. The bill also recognizes the right to access and maintain employment and not to be excluded because of a mental health disorder. Moreover, in 2019, the Chilean government introduced a bill on flexible working schedules with the purpose of encouraging employees to achieve a better work-life balance. However, parliamentary debates are currently being carried out on the matter. Isadora, would you please move to the next slide? Thank you. Even if there's still no legal framework for mental health care in Chile, there are some employer obligations to protect the mental health of their employees. In fact, pursuant to Article 184 of the Labor Code, the employer is required to take all necessary measures to effectively protect the lives and health of its employees, to report any possible risks, to maintain adequate hygiene and safety conditions on its place of business, and to provide the tools needed to prevent accidents and occupational diseases. Furthermore, the Chilean Labor Code also provides that all companies with 10 or more employees must have a handbook and internal rules of order of hygiene and safety rules. This handbook must contain a special chapter with rules and instructions on accident prevention and health and safety guidelines to be observed not only by the employer, but also by employees. In addition, the employer shall apply the monitoring protocol of psychological risk at work implemented by the Ministry of Health. In addition, due to the coronavirus outbreak, the Ministry of Labor and Social Security implemented a step-by-step return plan to work, which includes recommendations on mental health for employees and employees in the workplace, employers and employees in the workplace. This plan also includes highlighting mental health through establishing, for example, spaces for permanent dialogues, promoting health and well-being in the workplace, integrating employees and unions in the development of mental protocols, and also monitor all these measures implemented by the employer. But what mental health support have employers provided to employees before and now with the COVID-19? To answer this, I pass to Maria Ignacia Silva. She is the country people of Cisco System Chile, who will explain us how in practice is Cisco Chile taking care of their obligations on mental health at work. Please, Maria Ignacia, would you tell us their experience?
Thank you, Marcela. If we can go to the next slide, please, Isadora. Thank you. So I'm going to talk to you about a little bit what we did before and what we are doing now during COVID to prepare ourselves and our people for these mental health issues. So before COVID, we had a practice of work-life balance where we work by objectives and not by hour, so that the employees can arrange their time during the day so that they can complete their objectives. It is important to have clear objectives in order for this to work. The employee must know what is being measured to. Also, it is important to have a culture where managers trust their team. This is important also to apply a free home office policy so employees can do home office whenever they want and don't have to tell their managers whenever they are going to work from another place. Another practice we had before COVID in our company is the Cisco Optum program. This is a phone line where employees can call to get legal and psychological advice. This program is completely free for our employees and it is completely anonymous. One practice that we launched just before COVID and had to adjust to the new normal was our Cisco Babelka app. This app is based in 4 elements to have a balanced life. These are eat, sweat, think, and connect. For this, we have a website with all the information regarding the 4 elements and activities to practice them. But also we have a weekly webinars with experts in each theme and activities that promote the 4 elements. In Chile, for example, we have made Zumba classes, cooking challenges, mindfulness activities, and different happy hours for people to connect. We had to adjust for the launching of Babelka because all of the activities were planned for us to do it on the office. So now we had to do it all virtually and change our entire agenda. But this app was a huge success because it came in a time where people needed this activity to help them at this complicated time we were living due to the quarantine. This is something people have been using not only for themselves, but with their family also. So it has been a really nice experience. So talking now about what we have done during COVID, we have, well, we first had to listen to our employees and act fast so that we can respond to their request. So in our listening to the employees, we implemented two things. One of them is a day for me. This has been a days where Cisco have closed completely in the whole world, and we rest for a day in order for our employees to spend more time with their families and can get some rest. The second one is the interim reduced work week. This is a program open to all of our employees in countries where Cisco can offer part-time work options. We have heard from many about their struggles to balance work and home in the current environment, and this offers employee a shortened work week for a defined time frame. So it could be for 6 months, 1 year, 1.5 years, depending on how much time you want it. Of course, where it's possible and locally permissible. We also have the pandemic site. This is a website that we implemented with everything our employees need to know about COVID, such as frequently asked questions, online event with specialists, how is their return office strategy for each country, to register in case you have COVID so that we can assist you and help you in any way that we can, and a lot of other COVID related things. And finally, to help our employees with the remote work, we have a budget in order to adapt our employees' home into their workspace. We know that working from home has been difficult in many different ways, and one of them is not having the infrastructure to work from home. So we have given our employees a budget in order for them to buy, for example, a chair, a desk, a printer, or anything they could need so that they can adapt their workspace and have more comfortable place and experience. So that's the things we did before COVID and during COVID in Cisco to help our people during this phase and in their mental health.
Thank you very much, Maria Ignacia. It's very interesting, especially the Zumba classes. I really like them. Now I pass to Ignacio Maciel. He's the head of human resources of DHL Chile, who will describe to us how DHL Chile is promoting safe workplaces, as well as physical, mental health, and social well-being. Ignacio?
Well, first of all, thank you for the invitation, and I appreciate this opportunity to share with you what we are doing here in DHL. I start with this slide because I think even in the bottom of the slide, you can see the development of the neural processing of the child between 36 weeks until 2 years. And I think, and I try to make a comparison between what are we doing now, what we have been doing during a few years ago. You know, a few years ago, no one talked about the healthy or mental health in the companies. That was the problem of the employee. And also just we had just a social work at the human resource department. After that was the main thing was one of the part of position of the human resource department must be in a psychology, and that's it. That was everything. And now, a few years ago, as Marcela said in 2019, 2018, the Chilean government started to think about our concern about the healthy or mental healthy in the company, trying to be more productive for the company. We thought that the people is more healthy or more mental healthy or more happy. The people is more productive, even they have, this is not a monetary salary, it's a non-monetary salary that we try to give it to them. In terms to that things, we believe that there is an before and after to that goal, and well, we start working with new way to be part of the people and try to care about the healthy in terms of mental health and physical health. What we have, what we had a few years ago, maybe in 2018, we start thinking about the healthy of the people, and we start on a global program. We call it Well-being at DHL, and that program include many activities. And in Chile, we implement apps that come step for the workers, and we make contests between them. How actively are you in your own life? And we make a contest between different departments, trying to know, or that the physical health is related with the physical health. And in 2019, we ran a pilot trying to have an online psychological session for people who believe that they need it. And in that time, it was so hard to implement it. Even we needed to take out these benefits because no one believed in that session, in an online session. And well, later I'm going to tell you what I'm doing now with these benefits. And another things that we are doing, or we have been doing, is trying to be concerned about the time of connections of people, trying to control them, trying to be concerned. And HR role and a big is running a big role there, trying to control them, to control the leaders, and trying to be with them. And also in 2019, we implement restroom places where the people can take the time to have a snap of what they wanted in that time. Next slide, please. Here you can see how is our policy in health and safety and health and well-being. We live there all together, but we separate, trying to be concerned about the work and the personal life, and where the individual is in the middle of this strategy. And we believe, as I already told you, that if we are concerned about the mental health, we must be concerned about their nutrition or physical activities, and other thing is that control the tobacco or the use of the smoke, and also alcohol. And now in the last part is the infection protections, as part the coronavirus strategy of try to avoid them. And next slide, please. And what mean this? Well, the first of all, in here you have an harlequin on an harlequin. And why we have an harlequin? Because this represents one of the main things that we believe we can be sure that the mental health is part of our work. We believe in the respect and result. We don't, we trying to be so respectful for the people and for the environment that we believe. And this is a prize that we give every year for one department, that he can get or have a perfect balance between respect and result of the department. And another thing, important thing, that as a policy of well-being, we believe that if we are well-being company, we are concerned about trying to be social, trying to be present, and trying to be active. And that means trying to increase the engagement of the employees, and try to be care about the mental health and manage their stressfuls, and also trying to be more concerned about the physical healthy. And also in Chile, we have these special weeks. We call it as appreciation weeks, healthy weeks, where we bring to the company some screening or healthy screening, dental screening, ophthalmologic screening, trying to be concerned with them. And also, well, we give it to them on a day off to go to the medic once a year. It's like an entire review of him, and they can go to the doctor and without any more. They are free to do it. And the homework, home office was in 2019, in January 2019, that we start with the home office policy. Was so hard for us as a HR trying to implement it. You know, in that time, the home office was not viewed in the right way for the leaders and also for the workers because they don't believe that they can work at home. But the COVID bring it with a big news that the home office is a great chance to work. The people have a valued, they believe that they can give us a great contribution of the company, and they have a better quality of life. Um, that is important. And trying to end in now in the EF Chile, well, as I already told you, we implemented in a pilot in 2019 of the physical or online psychological sessions. And in that time, it doesn't work. But now with the COVID, it's working very well. People is using this benefits, and also it was really successful. And now we implement these benefits for all the Latin American countries. That is include Ecuador, Venezuela, Colombia, Peru, and Argentina. All of these countries are working with these benefits, and we can, and now it's working very well because the people believe that in the online sessions and the trying and the new way to live or new way to work. That's all. Thank you.
Thank you very much, Ignacio. It seems that both of your companies have very high standards on mental health, and I'm glad that you are prioritizing this issue because it's very important. And as we both said, like after the coronavirus outbreak, it has been a worldwide issue. So now, Hilary, I pass to Hilary and Tony, who will tell us their experience on mental health issues in workplaces in Canada. Hilary?
Thanks very much, Marcela, and thanks to Ignacio and Maria Ignacia for that detailed information. I'm just going to share my screen. Hopefully everyone will be able to see the slides. Oh, I'm sorry.
No.
Oops. Sorry. Try again. There we go. So as I said at the outset, my name is Hilary Grice. I am a labor and employment lawyer in Canada. And so today, Tony and I are going to be speaking about taking care to take care from the Canadian perspective. And our focus is going to be less about remote working and more about planning for and actually returning to the workplace. So just as a bit of an introduction, like most of the world, Canada essentially locked down in mid-March. And so at that point, many non-essential businesses throughout the country have had the majority of their employees working from home. And so here you can see a little bit of information about the impact of that potentially. So a recent poll in Canada has shown that 2 in 5 Canadians say right now that their mental health is worse than it was before the pandemic. And further, 25% of Canadians say that their mental health now is actually worse than it was during the first wave of lockdown back in the spring. So, it appears that the pandemic generally and also staying apart and staying at home are certainly having a toll amongst the Canadian population. But something that we're also seeing is, especially from our employer clients and from their concerns being expressed by their employees, is concern and anxiety and stress around the returning to work process and the mental health impacts of that. Things about, we're hearing about how do I get to work as an employee safely? What will my workplace be like when I get there? What will be the precautions that are being taken? Will they be enough? And then, what happens to me, or if I get sick, or what happens if one of my coworkers gets sick? Those are the sorts of concerns that we hear from employees and that their employers are looking to deal with as they plan this return to work process. So some of this was in process for a lot of Canadian employers. There was a slowdown in numbers during the summer, and so there was a real turn to let's see, plan and try to get our employees back into the workplace for the fall. Recent increases have meant that process has slowed down for many employers, which is just an opportunity to provide more time to plan and to reflect on our plans for bringing our employees back into the workplace. So as I said, today, Tony and I are going to talk about making those plans and structuring a return to the workplace for employees in a way that supports employees' mental health. Before we do that, I just wanted to touch on one unique mental health support that's available to all Canadians, whether they're working remotely or planning to return to the workplace or not currently working at all. And that's the Canadian government's Wellness Together initiative. So what that is, it's a website that provides a number of different services, including tech support, self-directed wellness programs, remote counseling. And we have today Tony here, who works for Homewood Health, who's one of the Canadian government's key partners in that initiative. So I'm going to turn things over to Tony to talk briefly about that before we get into some of the issues around return to work planning in a bit more detail. Over to you, Tony.
Okay, thank you, Hillary. So in May, early May of this year, our Prime Minister Justin Trudeau announced an initiative which is titled Wellness Together Canada. This is a national initiative. It's a service that's available to all Canadians, and it's actually a service that's available for Canadians that are also living abroad. So if you have a Canadian that's in your workforce that requires some mental health or addiction support, then you can tell them about this program as well. The service itself is accessible through a portal that's online, and it is a free service that's available. It contains different tools. There is a self-assessment that the individual would complete, and you can select what type of services you'd want to participate in. It also includes access to a clinician for support as well. So it's a fantastic resource, and it's available. People that register can track their symptoms. They can check their progress. You can get updates, and you can trust the resources that are available through this site.
Move to your next slide there.
Okay, so in Canada, like the rest of the world, in March, things changed relatively quickly. We underwent a lockdown or a quarantine. Many of our Canadian workers had their day-to-day work disrupted. In fact, Statistics Canada reported in early April that about 1 in 10 of our working age individuals had lost their jobs, or they were working less than half their usual hours. So it represented quite a significant impact to our economy, and unemployment and disruption in work has negatively impacted mental health. So it was important for us when the time came to support our workers, the Canadian population, with returning to work when things were safe. And over a period of a few months, our work environment started to reopen. Many of our Canadian employers left or allowed workers to remain at home. For some Canadian employers, it wasn't possible for the worker to remain at home. So in manufacturing and hospitality, those types of industries, it wasn't possible for the employee to return home. So employers were coming to organizations like our law partners, organizations like Homewood Health, to say, can you help me with planning this return to work? So Hillary and I actually worked together back in the spring of this year, looking at what are the principles associated with helping employers plan and manage this massive return to work for Canadian workers. And we borrowed quite heavily from practices and principles that we understand very well. And in fact, that relates to what's it like at an individual level to return to work from a period of absence. So whether it's a paternity or maternity leave or a health leave or other type of absence from work, what is it that we know to be true about being successful and managing that situation? So we actually use these principles to help our employers manage and plan the return to work. And the pre-pandemic principles are quite appropriate. They just have to be considered within the context of this COVID-19 scenario with a larger grouping of employees. And that relates to planning, communicating, managing risk, and evaluating how things are going. So whether it's planning the return to work or it's managing the ever-evolving situation that COVID-19 has thrust upon us, really those principles apply. So I'm not going to get into a significant level of detail about those principles. We have many HR experts on the phone that understand return to work planning. I would encourage you to go with what you know to be true, and when you're looking at return to work planning for a large group, borrow from your knowledge and your practices that you've done previously and has led you to be successful. So here you go, Hillary.
Thanks, Tony. And I think we can see from the previous information provided by Ignacio and Maria Ignacia how that can flow through from your pre-COVID practices to what we're developing as the situation unfortunately continues to progress. I want to talk briefly about some practical tips for navigating some of the more maybe legal considerations around returning to work planning, but that also tie into some of what Tony and other commenters today have said about the potential psychological impacts of those processes. So when we're managing employee mental health in the return to work process, a key thing to keep in mind, and this I think ties back to what Marcela has said about the Chilean situation, is that your general duties under occupational health and safety legislation, whatever that may look like, those continue to apply to what you need to do with respect to COVID-19 precautions. So in Canada, those obligations are, for the most part, provincially regulated. And so they might look a little bit different depending on what province you're in. But in general, what you're obliged to do as an employer is to take every reasonable precaution in the circumstances for the protection of your workers. And so when we're assessing what that looks like in the COVID-19 perspective, what is reasonable has generally thus far been interpreted as, what is the public health guidance? What are our public health units saying? What are our provincial and federal health experts advising? And that's where you're going to want to look as your sort of base in order to develop a return to work process and plan that's going to be legally compliant. Part of that is, of course, going to be conducting a hazard assessment of your actual workplace to determine, what COVID-19 related challenges are you going to have, and how are you going to develop methods to control them. And so, of course, that's going to look different depending on the nature of your workplace. In Canada, for example, there's been a move within offices to maybe hot desks, or at least open concept, so we don't have a lot of walls, we don't have a lot of offices with closed doors. What does that mean for you as you're bringing your employees back to work in terms of physical distancing and potentially mask requirements and things of that nature. So those are the sorts of assessments you need to do, while you're making your plans. And once you've made those assessments, you're going to want to create a return to work plan that's, as I said, legally compliant. So you're looking at what is the public health guidance, but also, addresses the hazards that you've assessed. So, what might that look like? You're probably going to want to cover things like, how do we track infections while respecting employee privacy? What sort of screening do we have, and when is that required to be done? Physical adjustments to the workplace, which, as I said, might range from, the lunchroom is closed so that we're not, closely mixing there, or a mask requirement, which we have in our offices, or in certain workplaces, putting up plexiglass barriers or floor markings on which way to move throughout the office. All different physical things that you can do in order to manage risk within your particular workplace. And then the key is to clearly communicate those plans and policies to your employees as part of the return to work process. First and foremost, that's probably part of your legal obligation to take all reasonable precautions. But, as has come up, I think, throughout what we've talked about today, it's an important part of mitigating the uncertainties, the stress, the anxieties that employees might be feeling as they prepare to sort of end their period of work from home and start coming back into the workplace. It's likely that employees who know that you as an employer are taking precautions, and actually what those precautions are, and so that they know what to expect when they show up to your workplace, are going to have less of that generalized concern around safety, right? Everyone these days is concerned about safety. And I think a big part of that is the unknown and not knowing what to expect and not knowing what steps are being taken. And so developing these policies first and foremost, but then making them very clear to your employees and communicating them in advance, that is going to help ease some of that strain on people's mental health. The other point that I wanted to talk about is the actual duty to accommodate. So, in Canada and provincially, this is again provincially regulated, but you have, an obligation to respect individuals' human rights, which include disability. And that continues, of course, to apply with respect to in the COVID-19 context. And part of that is your duty to accommodate. And if an individual does have a disability that for which adjustments need to be made. And of course, mental health and disabilities related to mental health will be considered disabilities and can engage the duty to accommodate. And so what does accommodation of employee mental health look like, particularly in the COVID-19 context? If, things that may manifest as anxiety or depression or something like obsessive compulsive disorder, those are all going to be considered disabilities that may manifest as a result of COVID-19 or the lockdown, or just the general state of the world in 2020. And so all of that could engage your duty to accommodate as an employer. In the mental health context, it's important to keep in mind that you're not, as an employer, expected to be psychic. You're not expected to read minds. And so an employee needs to make their needs known to you. And that includes, what they may be dealing with and what modifications may need to be made in order for them to be successful. But in the mental health context, there's of course a historic stigma that still can exist today. And so employees may still be hesitant to disclose to you as an employer that they're struggling. And so, luckily we have many resources that employees and Canadians generally can access. But from an employer perspective, you don't, as I said, you don't need to be psychic, but if you see an employee who is clearly struggling, you may have a duty to inquire into that, to actually take steps to ask the employee are you dealing with an issue? Do you require an accommodation? What can we do to support you? And so, to kind of keep things simple, I think what you don't want to do is turn a blind eye to issues that you may see developing but have not been expressly raised to you, particularly in the mental health context, and particularly when we're dealing with the ongoing COVID-19 situation. And so ultimately what your duty to accommodate will probably look similar to what it would look like in any context. It may mean time off work, it may mean an adjusted schedule or expectations, it may mean additional supports from supervisors or managers, it may be something like a referral to your employee assistance program or something else of that nature so that the employee can get the assistance that they need to be successful. And so I think in general, that brings me to the end of talking about the specifics around return to work in the Canadian context. I think at this point, it would be useful, Isadora, to see the results of the poll, and then maybe we can go into a bit of a Q&A. So there we see the results of the poll. I think a lot of the information that we were expecting to see, mental health is certainly a priority for many employers at this point in time. And I think some of the concerns that we maybe see from this poll is, do we have a policy in place in order to deal with some of those issues? And then, do we have the training in place to deal with it? Marcela, did you want to comment?
Yeah, well, the second one, it's surprising how organizations does not still have policy on work-life balance. It's 69% does not have any. So that's interesting, something companies should improve on, I think.
I think it's certainly a way to again, I think everyone benefits from clarity. And so if you have a written policy and a written practice, that can certainly help both you as a manager and your employees feel more comfortable with the process.
I do see also that those positions include managing, supervising, or support employees adequately trained, skilled, or competent to support employees struggling with mental health issues. That's again a no answer. And the last one, if company providing mental health support, it's good because it seems that 77% is doing that. So I don't know if I think we do not have more time to any questions, but the Q&A is open if any of you have one.
Well, if we have a minute, perhaps I could ask Tony a question that I had, which just to round us off, which is, Tony, you assist employers with dealing with these issues. What do you see as the biggest challenge with respect to employee mental health facing employers as they make these plans and either deal with remote work or bringing people back?
Mm-hmm. So as it specifically relates to COVID-19, we have to anticipate that there will be some anticipatory anxiety. That's very, very normal. So the challenge is sorting out when the stress response is typical and as expected and normal, and when it's potentially an indication that it's more problematic and that additional support and help might be required.
Right.
There isn't a person on the phone that hasn't had some anxiety or stress related to this pandemic. The question is that when do you know that it's more difficult, or that it's potentially going to be a bigger problem for you and impact your overall functioning? And that's the challenge for employers, employees, and mental health professionals is
right.
Normalizing, but making sure we're there to support employees that are most vulnerable and need it.
Thank you very much, Tony.
Yeah.
Thank you to everyone here.
Yes.
Isadora.
Thank you, everyone. We have now reached the end of this session, but the Legal HR Summit is not over yet, and we have other sessions coming up today. On your screens right now, you can see the next sessions that are coming up. They're simultaneous sessions. And if you wish to join, you can register on the link that I'm sending now in the chat. Even if you cannot attend, you can still register, and we're going to send you the recording of the session after the event. Finally, I would like to thank you everyone for attending this session, and thanks also to our panelists for the very healthy insights. So with that, the session will now be ending, and I hope to see you at the next one.